I really would like you to introduce yourself and talk about your research.
So I'm Lisa Pont. I'm a researcher from Sydney, Australia, and my research looks at the quality and safety of medicines across populations. So I'm often looking within health systems, sometimes I'm looking at the country level, and I'm really interested in are people receiving the medicines that they should receive, so the appropriateness of care, and are they at risk of medication-related harm. So basically drug utilisation research within a health system perspective.
Okay, so the first question for you is, in your research on medications used among older adults, what are the key challenges in collecting and interpreting real-world data from aged care settings, and how can these challenges be addressed to improve drug utilization studies?
Yeah, so I think one of the key challenges in my research has been access to data, and I've been very fortunate that I've worked with a pharmacy provider who provides medicines to a large number of aged care facilities, and we realised about 10 years ago that the pharmacy supply data was an accurate source of medicine use, and that we could actually use that data to understand the way medicines are being used for older populations. So it was a data source that no one else was using. It's real-world data. It gives us a lot of information, but it's only part of the picture. So I think understanding what's in my data and what's not in my data has been one of the challenges. So part of it is I've been very fortunate to have the data set, and now we've seen other people using similar data sets, but getting that data in a sustainable way has always been a challenge.
Okay, and the second question is, how can insights from drug utilization research in elderly population help inform safer prescribing patients and policy decisions in long-term care facilities?
Yeah, and I think this is really important, because I think doing the research is one part of it, but translating those findings into policy or into practice. So it's not always that it's going to go straight into policy, but I often work with the aged care facilities, I work with the pharmacy providers, and we're looking at how do we change practice from the findings of our research. So what do pharmacists need to do differently? What can we do differently with the aged care setting? How do we change the way medicines are being used? And working directly with the providers of the aged care services and allows us to translate those results directly. So I think it's about having those relationships with the practice settings that you're working in. So it's about understanding the data, it's about understanding the context or understanding the environment that you're working in, and then working in partnership with the settings. And I think that's been a big opportunity that we've been able to feed back both to the pharmacists and to the aged care facilities. And once that starts happening, then the policymakers get interested. So that's where we've come from.